Cornwall has seen an alarming rise in COVID-19 cases this week, but the numbers do appear to be flattening overall in Eastern Ontario. Joining me now to talk about the numbers and what they all mean is our Medical Officer of Health, Dr. Paul Roumeliotis. Welcome back, Doctor.
Good to be back.
All right, so we'll start with, of course, that large increase in cases in Cornwall. We were looking at, I think, close to 30 cases this week alone, pretty well doubling our count. So let's talk a little bit about where those cases are coming from and
Yes. Thanks. Yeah. We always look at the numbers, but we also look at where they're coming from and where we see, the sources. And so I can tell you that most of these cases are in clusters of families or related to an outbreak. As you know, we have an outbreak in one of the daycares in our area. And so the good news is that we know that they're there, and we had expected some of these because they're family members of people that were already positive. And so we've already contained them. We've already isolated those individuals. So it is better than saying, well, we had 30 cases that came out of the blue and we don't know where they came from, and they had a lot of people that they were in contact with. So from that sense, what we call that the epi-link. Is it an epidemiologic link? And there is. So that is the good news. The other side of it is that we're seeing increased numbers in our area, and we go by case counts per 100,000 people per week, and that's gone quite higher for Cornwall, the first time since the pandemic. And so we need to keep a close eye on that. But again, trying to look at where the numbers are coming from. But overall, we're seeing a a sort of stabilizing of our numbers at the local level. If you take away the massive numbers that were added over the last week and a half from our outbreak in Prescott Russell, that is announced Prescott Russell. So the good news is that we're flattening down. Cornwall is on the uptick. And again, from that point of view, we need to still be careful in terms of our public health measures. Stay home. Your bubble is your home now, is your household. No, unknown necessary travel. Don't go to other regions. And we're telling people from other regions not to come to ours as well. Make sure that you're physically distancing, masking, especially at work as well. We've got a lot of cases that have come out from people at work, and what happens is they go to the back with their coworkers and they forget about the public health measures. So that's important. But again, moving forward, I think if we kind of continue what we've been doing, and we've done a good job so far, but again, those numbers come up because of the outbreaks. Now is the time for us to sort of buckle down a bit more and help ride it out and just limit those increases that we saw in Cornwall to what we've seen now. The outbreak will be over, and hopefully the numbers will start going down again.
Absolutely, that's the hope. And given that we did see over the last week, as you alluded to, our first cases at a school, there's currently two cases at Holy Trinity, and you mentioned the daycare where there's currently 5. Maybe we could talk a little bit about what goes on behind the scenes, when you're talking about containing this, and how you work with those schools to make sure that contact tracing and cleansing of the facilities are done.
The most important thing for us is to understand if it's a child, if it's a staff or a student or whatever the situation is, where was that individual? When did that individual get sick? When did that individual get in contact? Who were the close contacts? Were the close contacts wearing masks? Were the child or the staff wearing masks? We do all those questions. Sometimes what we do is, because we don't have time to evaluate the whole class, we might send a letter and say, you know what, there's a case in the school, and there's a case so everybody receives that. But the people that are in the class of where the case occurred, they get a letter saying, we're going to contact you if there's a close contact, or stay home until we contact you tomorrow, because sometimes we get it very late and we don't know where the child was or the staff was. And so we might tell them, don't go to school tomorrow. We'll follow up with you, and then we can figure out where the individual who was positive was, and then we can make the necessary changes. And in that way, and then what we usually find is that, okay, where did the positive come from? It didn't come from the school. In all situations, it did not come from the school. It actually, except in one of the outbreaks, but what we find most of the time is that the individual got it from the community. So again, it gets in from the community into the school. We then clamp down, contain it, don't get any more cases. But if it wasn't in the community, it wouldn't have come to the school in the first place. So the bottom line is, the more there is in the community, the more it's going to get into the schools, and we handle daycares the same way as well.
All right, and of course, tomorrow is Halloween. We've sort of alluded to this before, but let's remind our viewers the Eastern Ontario Health Unit stance in terms of keeping safe this Halloween.
particularly during this time, and particularly in the Cornwall area and really the rest of our area where the numbers are still up there, I think it'd be very prudent that we look at other ways of celebrating, stay at home, put the costumes on with the kids and maybe have a chocolate hunt in your home or backyard or those type of things, have a virtual type of approach, because we don't want people to, gather. And that's the whole thing. So, gathering from one home to another, people will cluster. You see kids, clustering together and crossing the street and going and trick-or-treating. And it's also important as well for people giving out gifts. If giving out treats, if you're sick or you're an elderly individual, you might want to think twice. So again, unless you have some creative ways of shooting or throwing the treats far, that type of thing. So we're recommending a different approach this year. Again, important because we don't want the numbers to go up, and we're seeing the numbers go up, including in Cornwall. But if people still want to do it, we do have information on our website that shows them how to do it in a safe way. Distancing and those type of things. But bottom line is, it's not going to be a Halloween as usual. Let's hope, however, that we can get those numbers down so we can maybe have a bit of a more normal or less restrictive Christmas. It's really less than 2 months away.
Absolutely. On that note, Dr. Paul, thank you so much for joining me for this week's update. Best of luck moving forward.
No problem.